Hi friends, I'm Dr. Vandi MS. Today I'm going to share with you on the topic Universal Health Coverage and Ayushman Bharat. Before going to today's topic proper, let me tell you all one thing that if anybody watching this video not yet subscribe my channel, please do subscribe and press the bell icon so that you will get all videos related to recent advances in medical field and public health when I'll upload in this channel. So coming on to today's topic, Universal Health Coverage and Ayushman Bharat. These are the things I'm going to share with you today. Under universal health coverage, something related to introduction, then definition, aim, goal, objectives, coverage box of universal health coverage, strategies by WHO, UN and UHC, India and UHC, and finally relate something regarding Ayushman Bharat program. So coming on to universal health coverage in proper. For human welfare and sustained economic and social development, promotion and protection of health is important, and this was recognized in the second half of 20th century, and thus world leaders gathered and signed the Alma Ata Declaration to attain health for all by 2000 AD through PHC strategy and later on inclusion of health sector system reforms. When analysis of health was carried out in the year 2005, some findings on the service coverage side were alarming. And these were the findings. In some countries, less than 10% births were attended by skilled health workers. Poor children were dying earlier and rich children were living longer. Groups like migrants, ethnic minorities were using health services far less than other population groups. In many countries, up to 11% of population faced financial hardships every year due to illness, and up to 5% to them were forced to impoverished status. And they also found out that access to preventive, promotive, curative and rehabilitative health services was critical. And thereby on 2005, WHO recommended strategy called as UHC, Universal Health Coverage, with emphasis on sustainable health financing. And what is the definition of universal health coverage is access to key promotive, preventive, curative and rehabilitative health interventions for all at an affordable cost, thereby achieving equity in access. This is the definition of universal health coverage. The aim of UHC is to improve the access to health coverage and ensure health security. And the goal is to develop health financing systems in countries so that all people have access to services and do not suffer financial hardship while paying for these services. And what are the objectives of UHC? Number one is reducing mortality or morbidity. Number two, ensuring patient satisfaction. Number three, preventing financial impoverishment from catastrophic cost of illness. These are the three objectives of UHC. And coming on to coverage box of UHC, there are three main dimensions of UHC, that is population, services and direct cost. These dimensions allocated by WHO provides a picture to show that the coverage is done mainly for number one, population coverage, that is to extend services to the population which have not yet been addressed. And number two is health service coverage, which includes other areas where the health facilities have not reached yet. Thirdly, financial coverage, that is reduce the cost sharing and fees while obtaining health services. These are the three dimensions of this, that is population, then health service, then financial direct cost. Okay. So coming on to strategies by WHO in 2005 for developing health system towards universal health coverage. Prepayment of financial contributions, that is health insurance for health care in a health financial system to protect individual or family to protect against catastrophic effect of out-of-pocket expenditure. And ensure good quality healthcare facilities, health manpower and essential services are adequately and equitably distributed. Then all funds and activities under specific health programs are to be managed and organized in an integrated way. Then plan keeping in mind international development goals and contextual to socio-cultural, political and economic scenario of the community, and development of PPP, that is public-private partnership. These are the strategies that is adopted by WHO for developing health system towards universal health coverage. Then coming on to UN resolution for universal health coverage. On 12th December 2012, United Nations adopted a resolution promoting universal health coverage as a tool to promote human development. And this day is considered to be UHC Day, Universal Health Coverage Day, on 12th December 2012. And UN urged all countries to provide affordable, quality healthcare to the citizens by accelerating progress towards universal health coverage as an essential priority for international development. UN also adopted UHC as a strategy for post 2015 development agenda. Coming on to sustainable development goals and universal health coverage. As we all know that there are 17 goals in sustain SDG, and third goal is directly related to health, that is ensure healthy lives and promote well-being for all at all ages. And target 3.8 of SDG 3 is mainly focusing on universal health coverage, that is achieving universal health coverage including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all is the key to attaining the entire goal as well as the health related targets of other SDGs. And target 3.8 has two indicators. Okay, first indicators on coverage of essential health services, second on the proportion of countries' population with catastrophic spending on health. This is about SDG and UHC. Coming on to UHC and India, what is the relation between UHC and India? Government of India has taken steps to ensure equitable access to affordable, accountable and appropriate health services of assured quality to every citizen of India, irrespective of their income, social status, gender, caste, religion and region. Three important steps they have taken, India government has taken towards achieving UHC. That is, number one is National Health Policy 2017. Number two is National Health Protection Schemes for 10 crore families. Number three is creation of 1.5 lakh health and wellness centers. Coming on to Ayushman Bharat. Government of India on 1st February 2018 announced in financial budget of 2018 to 2019 two major initiatives in health sector as part of Ayushman Bharat program. Number one is Health and Wellness Center. Number two is National Health Protection Scheme. These are the two schemes that I already mentioned in universal health coverage that is adopted by Government of India. There are three main things that is adopted by India for achieving universal health coverage. Number one is National Health Policy 2017, then Health and Wellness Center, National Health Protection Scheme. The aim of Ayushman Bharat program is making path-breaking interventions to address health holistically in primary, secondary and tertiary healthcare systems, covering health promotion as well as health prevention. Coming on to National Health Protection Scheme under Ayushman Bharat, approximately 62 million of our population has to pay for their own health and hospitalization expenses and are not covered through any form of health protection. Besides using their income and savings, people borrow money or sell their assets to meet their healthcare needs. Nearly 5 to 6 crore Indians are pushed into poverty every year because they are unfortunately compelled to spend half of their annual household expenditure to meet medical needs. Various state level government insurance schemes already exist in India, but still 80% of population are not covered under any insurance scheme. And on September 23rd, 2018, our Prime Minister of India launched Ayushman Bharat, which is the world's largest government-funded healthcare scheme in Jharkhand's capital Ranchi. And it is named as PMJAY, also known as Ayushman Bharat National Health Protection Scheme. And this includes existing RSBI and Senior Citizen Health Insurance Scheme, CHIS. What are the features of National Health Protection Scheme? Over 50 crore Indians to be covered, and families are identified as per socio-economic caste census 2011. Then beneficiaries are poor, deprived, rural families and identified occupational category of urban workers families, and cover of rupees 5 lakh per family per year for secondary and tertiary care hospitalization in all M-panel public and private hospitals, and there will be no cap on the family size and age. Okay, how many, even though in RSB there it was allowed for only 5 family members, now it can be whatever how many family members, that's not we don't want to worry about that. Okay, whoever family members are there, they're all, these health program is applicable to all the family members. Okay, and there will be no cap on the family size and age, and the funded is 60 to 40%, 40 by central and state accordingly, and to be merged with other state schemes. These are the major features of National Health Protection Scheme, and these are the beneficiaries under rural areas, and based on what socio-economic caste census 2011. D1 is families having only one room with kacha walls and kacha roof. D2 is family having no adult member between ages of 16 years and 59 years. D3 is female headed households with no adult male member between the ages of 16 years and 59 years. D4 is disabled members and no able bodied adult member in the family. D5 is SC or ST households. We can remember like this, 5 looks like S, like that. D5 is SC or ST households. D7 is landless households depriving major part of their income from manual casual labor. This is about rural area. Coming out to urban area, there are 11 defined occupational categories are there, like beggars, rag pickers, domestic workers, like that. Okay, there are almost 11 categories, 11 defined occupational categories will get benefit under this scheme. And there is certain exclusion criteria for this scheme too. Okay, these are the exclusion criteria. Households having motorized 2 or 3 or 4 wheeler or fishing boat, then households having mechanized 3 or 4 wheeler agriculture equipment, then households having Kisan credit card with credit limit above rupees 50,000, then household member is a government employee, households with non-agriculture enterprises registered with government, any member of household earning rupees 10,000 per month, then households paying income tax, households paying professional tax, house with 3 or more rooms with pakka walls and roof, owns a refrigerator, owns a landline phone, owns more than 2.5 acres of irrigated land with one irrigation equipment, owns 5 acres of more of irrigated land for 2 or more crop season, owning at least 7.5 acres of land or more with at least one irrigation equipment, and these are the exclusion criteria for under Ayushman Bharat. And what are the benefits of PMJAY? Okay, Pradhana Mantri Jan Arogya Yojana scheme help India progressively achieve universal health coverage and sustainable development goal. Then ensure improved access and affordability of quality secondary and tertiary care services. Then significantly reduce out-of-pocket expenditure for hospitalization, align the growth of private sector with public health goals, then enable creation of new health infrastructure in rural, remote and underserved areas. More than 1 lakh long-term and 80 lakh short-term jobs will be created, and increase health expenditure by government as a percentage of GDP, then enhance patient satisfaction, improved health outcomes, improvement in population level productivity and efficiency, improved quality of life for the population. These are the benefits of PMJAY scheme. And second one under Ayushman Bharat program is Health and Wellness Center. Okay. Subcenter is the first hope of healthcare for the remote population, and optimal utilization of subcenters is hindered due to poor infrastructure, lack of manpower, geographical barriers, weak monitoring and supportive supervision. They either refrain from seeking healthcare services or resort to alternate solutions, which includes unskilled practitioners. When treatment fails, they travel to cities and private healthcare facilities for better quality of care, overburdened hospitals, and unaffordable out of pocket expenses they have to face after that. And to address these problems, the sub-centers are to be converted into health and wellness centers and thus provide better infrastructure and services. On 14th April 2018, our Prime Minister again launched the first health and wellness center at Jangla in Bijapur in Chhattisgarh. So, this is a proposed infrastructure and staff pattern in Health and Wellness Center, which was earlier called a sub-center. Infrastructure is branding or color coding of all sub-centers will be done, and citizen charter will be displayed at each sub-center. Then there will be space for examination room with adequate privacy. Then diagnostics and medicine dispensation room, wellness room and waiting area, and there will be a labor room at delivery points. This is the infrastructure of Health and Wellness Center. Then there is some staff pattern is there. Okay, number one is mid-level health provider, which can be qualification is BSc nursing or GNM or Ayurveda practitioner trained in 6 months certificate program in community health or community health officer. Then there will be a multi-purpose worker female, there will be two multi-purpose worker females, and there will be one multi-purpose worker male, and 5 archers will be posted as outreach team per health and wellness center. Okay, this is the proposed infrastructure and staff pattern for health and wellness center. And these are the package of 13 comprehensive services will be given under health and wellness center, that is care in pregnancy and childbirth, neonatal and infant health care services, childhood and adolescent health care services, family planning, contraceptive services and other reproductive health care services, management of communicable diseases national health under national health program, and management of common communicable diseases and general outpatient care, then screening and management of NCDs like diabetes, hypertension, like that, then screening and basic management of mental health ailments, then care for common ophthalmic and ENT problems, then basic oral health care, geriatric and palliative health care services, emergency medical services, promoting wellness through yoga. And these are the 13 comprehensive services that is done through health and wellness centers, which was previously called as sub-centers. So thank you all for watching. So these are all things for today. So we have learned regarding Ayushman Bharat, which is adopted as a part of universal health coverage in India. And there are mainly two components under Ayushman Bharat, that is National Health Protection Scheme and Health and Wellness Center. And we have learned regarding features, what are the inclusion and exclusion criteria. Like that we have learned a lot of things. So thank you all for watching this video. If you like this video, please share with your friends and also like and subscribe my channel, so that you will get all videos that I'll upload related to recent advances in medical field and public health in my channel. So thank you all for watching. Thank you.